Vitamin D deficiency during pregnancy can have significant consequences for both the mother and the developing fetus. Here are some warning signs of vitamin D deficiency in pregnancy. Maternal warning signs. 1. Fatigue and weakness. Feeling extremely tired and weak, even after resting. 2. Mood changes. Experiencing depression, anxiety, or irritability. 3. Bone pain or cramps. Feeling pain or cramping in the bones, particularly in the back, hips, or legs. 4. Muscle cramps. Experiencing muscle cramps, especially in the calves or thighs. 5. Hair loss. Noticing excessive hair loss or brittle hair. Fetal warning signs. 1. Intrauterine growth restriction, IUGR. The fetus may not be growing at a normal rate. 2. Increased risk of gestational diabetes. Vitamin D deficiency may increase the risk of developing gestational diabetes. 3. Preeclampsia. Vitamin D deficiency may increase the risk of preeclampsia, a condition characterized by high blood pressure and damage to organs such as the kidneys and liver. 4. Neonatal hypocalcemia. Newborns may experience low calcium levels, which can lead to seizures, tremors, or muscle cramps. 5. Increased risk of respiratory distress syndrome. Vitamin D deficiency may increase the risk of respiratory distress syndrome in newborns. Risk factors for vitamin D deficiency in pregnancy. 1. Dark skin tone. Women with darker skin tones are at higher risk due to reduced vitamin D production in the skin. 2. Limited sun exposure. Women who spend most of their time indoors or live in areas with limited sunlight are at higher risk. 3. Vegetarian or vegan diet. Women who follow a vegetarian or vegan diet may be at higher risk due to limited vitamin D sources. 4. Obesity. Women with obesity may be at higher risk due to reduced vitamin D bioavailability. 5. Kidney or liver disease. Women with kidney or liver disease may be at higher risk due to impaired vitamin D metabolism. Prevention and treatment. 1. Vitamin D supplements. Pregnant women should take a prenatal vitamin containing vitamin D, 600-800 U per day. 2. Sunlight exposure. Spend time outdoors, and expose skin to sunlight for 10-15 minutes, 2-3 times a week. 3. Dietary sources. Include vitamin D-rich foods in your diet, such as fatty fish, fortified dairy products, and mushrooms. 4. Regular checkups. Schedule regular prenatal checkups to monitor vitamin D levels and address any deficiencies. Here are some additional resources and information on vitamin D deficiency in pregnancy. Vitamin D deficiency complications. 1. Preeclampsia. Vitamin D deficiency may increase the risk of preeclampsia. 2. Gestational diabetes. Vitamin D deficiency may increase the risk of gestational diabetes. 3. Intrauterine growth restriction, IUGR. Vitamin D deficiency may increase the risk of IUGR. 4. Preterm birth. Vitamin D deficiency may increase the risk of preterm birth. 5. Low birth weight. Vitamin D deficiency may increase the risk of low birth weight. Vitamin D deficiency diagnosis. 1. Blood tests. Measure vitamin D levels in the blood. 2. Physical examination. Assess for signs of vitamin D deficiency, such as bone pain or muscle weakness. 3. Medical history. Review medical history for risk factors, such as limited sun exposure or dietary deficiencies. Vitamin D deficiency treatment. 1. Vitamin D supplements. Take a prenatal vitamin containing vitamin D, 600-800 U per day. 2. Sunlight exposure. Spend time outdoors, and expose skin to sunlight for 10-15 minutes, 2-3 times a week. 3. Dietary changes. Include vitamin D-rich foods in your diet, such as fatty fish, fortified dairy products, and mushrooms. Prevention. 1. Maintain a healthy diet. Include vitamin D-rich foods in your diet. 2. Stay physically active. Regular exercise can help maintain strong bones. 3. Get enough sunlight. Spend time outdoors, and expose skin to sunlight for 10-15 minutes, 2-3 times a week. 4. Take a prenatal vitamin. Take a prenatal vitamin containing vitamin D, 600-800 U per day. Subscribe and share.